That is very important because when we say sickle cell is no longer a death sentence, in my own time, when I was born again, because I was born again several times, because my mother had 7 of us, and most of them died at childbirth. So in fact, in my own time, sickle cell was a death sentence even at birth, because the mothers were not properly cared for. So in fact, having survived that and survived the name Abiku, I'm very proud to be here. And I'm not 65, I'm closer to 105. And thanks to, that's why, for instance, I have a passion for sickle cell disease. Not to also not emphasize the fact that Professor Ronka Akishete introduced me to hematology. And she's very angry that there was no prize in hematology, that otherwise I should have got it. But it was her fault. She did not have a prize in hematology. And Professor Akinyoju, of course, was our most respected professor of hematology. And he also taught me a few things about hematology. Now, truly, as I was developing that, as I was saying earlier on, sickle cell was a death sentence even at birth. At that time, people don't live beyond a year or 2. And I know because my own siblings, I had siblings who died around age of 3. And I remember vividly what caused their problem. And they had what they call the hands and foot syndrome. My little sister was very fair, which meant she had anemia, they had pains and so on. But there was no proper way to care for them. But things have really changed. Things have changed. And I don't want to take over the function of our erudite discussants today and lecturers today, but things have changed in all aspects. And you can see the Sickle Cell Foundation, what they do. They deal with prevention, they deal with early diagnosis, they deal with drug treatment. They've now moved from that to stem cell treatment. Sometime I hope they will get to genetic system, genetics. So, in fact, our 65-year-old, I can tell you, you have a good chance of living to 90, because I know people who are in their 70s at this point, and they don't look like they're going to die in the next 20 years. So you don't look into it. So it's no longer a death sentence. I'm now beginning to sound like a debater in secondary school, which says, discuss sickle cell, a death sentence or not, and I'll come up and say all those beautiful things they said. But I don't want to retrogress into secondary school, and I don't want you to believe that today is a day of, there is no debate about it. There is no longer a debate about the fact. And we thank institutions like the Sickle Cell Foundation. The Sickle Cell Foundation started when, as a sickle cell club, founded by Professor Akinyoju, and it looked like something like something that he just wanted to do, like a hobby. Now is one of the most distinguished foundations in Nigeria. I want to give you time to be able to listen to our heritage speakers, and by the time they finish, we will know that sickle cell is definitely not a death sentence. Ladies and gentlemen, thank you very much.
A wonderful round of applause for Dr. Sonny Kuku. First class, University of Lagos. 20 degrees. I believe you are appreciating Dr. Sonny Kuku. But the part that connected with me significantly is what happened in 1978 with the establishment of the Eco Hospital. Where were you in 1978? Not for all of us, though. I just arrived about that time. So if I said I just arrived, I didn't say that was when I arrived. Because some people do a quick mathematics and say, okay, so you must be. And when he said he was half, you know, and we were serious. I was a carrier. And please keep smiling. Keep smiling as you welcome her. You can see she's smiling very well. Now, one housekeeping. Ms. Lanre Ajayi, please go ahead. Ms. Ajayi, you have the floor. Your goodwill message.
Hello.
Can't hear you. She can't.
Please send her a direct message so she can comment. We can see her.
She can't hear you. She can't hear you.
Ms. Ajayi, we can see you. She needs to unmute, yes. All right, please send her a message so she unmutes and we can see her. Ms. Lanre Ajayi, we're ready for you now. Fantastic.
Can you hear me? Hello, good morning.
Yes, we can.
Wonderful, wonderful. Thank you so much for having me. So greetings to you, Dr. Akinyoju, whom I've known for many years. So nice to see you again as the founder of the Sickle Cell Foundation of Nigeria, the board of directors, and Dr. Annette Akishete, the CEO of the Sickle Cell Foundation of Nigeria, esteemed speakers, distinguished ladies and gentlemen. It's with much pleasure that I join you this morning to celebrate World Sickle Cell Day 2023. Sickle cell disease is the most common inherited blood disorder worldwide, and is caused by an abnormal hemoglobin HB called HbS. The World Health Organization in 2006 and the United Nations in 2008 recognized sickle cell disease as a global public health priority. And in order to raise awareness of the disease, designated the 19th day of June every year as World Sickle Cell Day. The World Health Organization estimated that sickle cell disease affects nearly 100 million people worldwide, and over 300,000 children are born every year with the condition. Tragically, the majority of these individuals will die in childhood due to a lack of basic care, and those who survive into adulthood would often face a life of chronic disability and premature death unless disease-modifying therapy can be provided. The WHO Health Organization therefore urges countries affected by sickle cell disease to establish health programs at a national level and to promote access to medical services for people affected by sickle cell disease. We all know that the highest disease prevalence is in sub-Saharan Africa, chiefly Nigeria, followed by the South Asia, the Middle East, and South America. However, over recent years and due to migration, sickle cell disease is now found everywhere and has thus become a global disease. So the Global Action Network for Sickle Cell and Other Inherited Blood Disorders, launched on April 6, 2023, is using this medium to encourage governments, clinician organizations, and patient organizations to utilize this day as a stepping stone to jointly advance policy changes that will improve the health outcomes for people living with sickle cell and other inherited blood disorders. As a collective, we can improve the health outcomes of people affected by inherited blood disorders, regardless of where they live in the world. We will strive towards equitable access to care. We will advocate for and improve care infrastructure for all people living with inherited blood disorder. The Global Action Network for Sickle Cell and Other Inherited Blood Disorders will enable advanced shared priorities within the inherited blood disorders community through unified and coordinated data-driven advocacy. And in this spirit, I thank the other organizers of today's lecture as they aim to debunk the myths around sickle cell disease, shine light on the peers living with this disorder, and support community learning on advances in management of sickle cell disorder, importance of accurate diagnosis, and living and thriving well with sickle cell disease. Truly, sickle cell disease is not a death sentence, but we must work together to ensure that people living with sickle cell disease have equitable access to care and they can live to the fullness of their life. Thank you again for having me, and I wish you a very, very enjoyable celebration today. Thank you.
Awareness is key, and all critical stakeholders must continue to play up and scale up advocacy to ensure that people are adequately armed with the required information to prevent the disorder from wreaking havoc. I must again commend the Sickle Cell Foundation Nigeria for coming up with this lecture to advance awareness and education around sickle cell disorders in Lagos State in particular and Nigeria as a whole, in order we play our own part effectively to ensure that we move from talk to action. And we all know what Lagos State is known for. We are action. We make sure things work. We are the first of all states. I think we should be giving a round of applause for that. At least our president came from Lagos State. A round of applause for us. I have no doubt that we are blessed with brilliant and intelligent minds, but I charge us to make all these resources count with our actions going forward. I know for a fact that the Lagos State government is committed to ramping up all branches of healthcare delivery, including sickle cell disorder, in line with the themes and agenda of the administration of Mr. Governor Babajide Olusola Sanwo-Olu. On a final note, I again deeply appreciate and commend the Sickle Cell Foundation Nigeria and other partners for putting together such a great event, which is essential in setting the agenda for improvement in healthcare delivery as it relates to sickle cell disorders. Thank you very much. Thank you.
Please, a round of applause for her. She reminded us, ably so, that Lagos is referred to as the center of excellence. Representing the Chief Medical Director of LUT is the Deputy CMAG. She will be giving us a goodwill message, Dr. Yewande Oshodi. Please appreciate her as she comes.
Thank you very much. Good morning, distinguished ladies and gentlemen of the high table. Good morning, ladies and gentlemen attending physically in person and those online. I'm here representing the Chief Medical Director of the Lagos University Teaching Hospital, Professor Lanre Adeyemo, who is currently unable to be here due to other official engagements. He had come in earlier on, briefly, before we started, and he's asked me to just extend a few words of goodwill to you. You know, the Sickle Cell Foundation is a partner of the Lagos University Teaching Hospital. We sit literally opposite one another. Just the road, Ishaga Road, separates us, and that essentially tells the story of our relationship. We've had a relationship of many years, and we want to thank the board and all the stakeholders for being consistent and being accessible for us to continue to build on that relationship. We'd like to congratulate you today, you know, the management and the board of the Sickle Cell Foundation, as you mark the World Sickle Cell Day. It's a day that comes in, year out, but you have remained consistent. And we want to congratulate you and celebrate you. A round of applause is okay. Thank you very much for staying the long haul, for being consistent, for being an advocate, for being a voice for many that do not have their voice. Amongst many ways in which we've collaborated with the Sickle Cell Foundation, we collaborate on clinical matters, we collaborate on research, the hospital, and more importantly, recently we've collaborated in setting up what I would call the state-of-the-art bone marrow transplant center at the Lagos University Teaching Hospital. A round of applause, yes, thank you for that. And we didn't do this alone, we did it in collaboration with the Sickle Cell Foundation, the Lagos State Government, and the Vanderbilt University. This center would be, we believe, the panacea that will answer many questions of care for many individuals who live with sickle cell disorder. Did I get that right, sir? I almost said disease, sickle cell disorder. And we're hoping that very soon we will open the doors of this center for bone marrow transplant procedures to begin. It's state of the art, it is fully equipped, it is manned by experts, you know, and we have partnership with international personnel who are also committed to seeing this succeed. So we're super excited and we're very proud of that partnership we have shared. Thank you very much. So on that note, today we want to just congratulate you and thank you for your visionary leadership in the care of sickle cell disorder amongst the populace in Nigeria. Thank you very much. Thank you.
Thank you very much, ma'am. Please, let us be generous with our applause. I am wondering why we are holding back our applause. Please be generous with it. It appears that the fear of Professor Akinyoju concerning disorder and disease is the beginning of communication wisdom. Because everyone, when you get to sickle cell disorder. So please, if you're coming up here, when you are coming up, please take note. It is not regarded as a disease, but a disorder. There is something I find very interesting with Professor Akinyoju's communication. He has never been shy to let you know the state of his medical position. He will tell you like a badge of honor, I am this age, I am dealing with this, but I'm doing well. A number of people are going through certain things and they're very much extremely CIA and FBI compliant. How are you? I'm okay. Is everything all right? I'm fine. What's the challenge? Nothing. Or you find certain persons that should be wearing glasses, they refuse to wear it and they pick up the paper There's not enough light here. What is wrong? This print is too small. I'm learning a lot from Professor Akinyoju on today. It's wonderful. We have someone. Please celebrate him. Thank you. Be generous with your applause, please. We have, representing the Permanent Secretary of the Federal Ministry of Health, representing Engineer Olufunso Adebiyi, is the Director of Non-Communicable Diseases in the Federal Ministry of Health, Nigeria, Dr. Deborah Odo. She's online. She's going to be giving us, please celebrate her, appreciate her. We have a star-studded event. We have representatives from everywhere, World Health Organization, LUT, Pfizer, Ministry of Health, Federal. The First Lady is here represented. And so we are going to be having Dr. Deborah Odo, Director of Non-Communicable Disease at the Federal Ministry of Health. Dr. Deborah, I know you are there.
Good morning.
Okay, Dr. Deborah, you have the floor now.
Thank you. Her Excellency, the First Lady, the Honorable Chairman, Commissioner of Health, the Chairman of this occasion, Olorogun Dr. Sonny Kuku, OFR, the guest of honor, Professor Ibironke Akishete, the founder, Sickle Cell Foundation Nigeria, Professor Olu Akinyoju, the Chairman and Board of Directors, Sickle Cell Foundation, the National Director and Chief Executive Officer of the Foundation, Dr. Annette Akishete, a former director with the Federal Ministry of Health, and my mentor, the representative of the Chief Medical Director of the Lagos University Teaching Hospital, distinguished speakers and panelists for today's event, the representative of the World Health Organization, esteemed partners, sickle cell warriors in the room and online, ladies and gentlemen. Good morning. I bring greetings from the Permanent Secretary of the Federal Ministry of Health, Engineer Olufunso Adebiyi, and the Director and Head of the Public Health Department, Dr. Morenike Alex Oko. They would have loved to be part of this event, but due to the exigencies of duty, they cannot join us. Permit me to read the message from the Permanent Secretary. A goodwill message from the Permanent Secretary, Federal Ministry of Health, Engineer Olufunso Adebiyi, at the annual public lecture on sickle cell disorder organized by the Sickle Cell Foundation of Nigeria to mark the 2023 World Sickle Cell Day on the 19th of June, 2023. It is my pleasure to express my felicitations to the leadership of the Sickle Cell Foundation Nigeria at yet another annual public lecture on sickle cell disorder with the theme, Sickle cell disorder is not a death sentence. As has been mentioned, Nigeria has the largest number of people living with the disorder in the world, with up to 25% of Nigerian adults carrying the sickle cell trait and well over 150,000 children born with the disorder annually. Sickle cell disorder is responsible for 8% of the infant mortality rate in Nigeria, with up to 50% of affected children dying before the age of 5. In recognition of the huge burden of sickle cell disorder and the socio-economic and psychological trauma, the government of Nigeria over the years has instituted policies and several strategic interventions to address the challenges of the disease. I must acknowledge at this point that the Sickle Cell Foundation Nigeria has been a close ally of government, providing tremendous support to our efforts by way of advocacy, awareness creation, provision of genetic counseling, and the formation of numerous sickle cell clubs. The foundation has also participated actively in policy development and implementation, capacity building of health workers, especially genetic counselors, and research. We recognize the contribution the foundation has made over the years in ensuring that affected persons receive quality care, and we are proud of the achievements recorded in the provision of bone marrow transplant facilities. As a country, the prevention, management, and control of sickle cell remains a priority, and among other things, our focus for this year includes the integration of sickle cell care and services into maternal and child health services, especially at the primary and secondary levels of care in Nigeria, in order to improve early identification of cases and enrollment into comprehensive care. Also, the institutionalization of early identification of cases through universal newborn screening at all levels of care, with the deployment of the newly validated, efficient, and cost-effective point of care screening methods that can identify the sickle cell disorder in newborns. We are also revitalizing and repositioning the 6 sickle cell centers of excellence for improved service delivery. We will be strengthening research, supportive supervision, and monitoring and evaluation across the country. We will also be partnering with social, community, civil society groups, development partners, and the private sector to improve social impact, initiate and enhance sickle cell surveillance. The prevention, management, and control of sickle cell cannot be undertaken by government alone, considering the enormous work that needs to be done to surmount the challenges of funding, infrastructure, and human resource development, and a myriad of others. And so we are appreciative of the support we receive from non-governmental and civil society organizations, such as the Sickle Cell Foundation Nigeria. Any success recorded by Nigeria in the campaign to reduce the burden of sickle cell will not be complete without documenting the contributions of the Sickle Cell Foundation. And we recognize and celebrate this and look forward to more fruitful collaborations ahead. May God bless the foundation. God bless all sickle cell warriors and their caregivers. God bless the Federal Republic of Nigeria. Thank you.
B 1986 and FAS 2006. She retired as Professor of Hematology and Blood Transfusion from the College of Medicine, University of Lagos, and the Lagos University Teaching Hospital, LUTH, in 2003. During her years at the University of Lagos, where she was fondly called the perfect professor by her students, Professor Akinshete supervised several research projects at both undergraduate and postgraduate levels, including doctoral dissertations. She is extensively published in peer-reviewed international medical journals and has co-authored several medical books. Between 2000 and 2003, Nigeria was blessed to have Professor Ibironke Akinshete as the pioneer chairman of the National Action Committee on AIDS, NACA, and a senior special assistant to President Olusegun Obasanjo on HIV and AIDS. She sets the stage for Nigeria's multi-sectoral strategy for the control of HIV and AIDS, ensuring that the country had sustainable global funding for the control of HIV and AIDS. It was during her tenure that the foundation for a multi-sectoral and expanded national response to HIV and AIDS in Nigeria was laid. She was able to get the support of several international organizations, including the World Bank, USAID, UNAIDS, the Global Fund for HIV and AIDS, Malaria and Tuberculosis, the Bill and Melinda Gates Foundation, and many others. Akinshete was appointed chairman of Lagos State Blood Transfusion Committee, LSBTC, in 2005 to regulate, monitor, and control blood transfusion practices in Lagos State in order to ensure safe blood for all citizens. In addition, Professor Akinshete was the pioneer chairman of Pathcare Laboratories, now called SynLab, Nigeria, from 2004 to 2018. This was the only internationally accredited ISO 15189 laboratory and the very first laboratory in West Africa to attain that status in 2006. Professor Akinshete is currently a trustee and board member of the APIN's Public Health Initiatives. APIN is the acronym for AIDS Prevention Initiative of Nigeria. She's also a past board member of Management Strategies for Africa, MSA, and a trustee of the Society of Women and AIDS in Africa, Nigeria chapter, SWAN. Professor Akinshete is a member of the Nigerian Medical Association, NMA, past president of Medical Women's Association of Nigeria, Lagos State branch, International Society for Hematology and Blood Transfusion, past president of the Nigerian Society for Hematology and Blood Transfusion, past president, Cancer Society, International Society for Blood Transfusion, African Society for Blood Transfusion, and the Association of Pathologists of Nigeria, ASOPON. Prof was the pioneer president of Society for Women and AIDS in Africa, Nigerian chapter, which has won several awards, including the World Bank Award for its work in the prevention and control of HIV and AIDS in Nigeria, particularly amongst women. Professor Akinshete received the Nigerian Healthcare Excellence Award in 2017, an initiative of global health projects and resources in partnership with the Global Strategic Healthcare Forum, the ANADAC Group USA. She's currently the chairman of the medical board of Archbishop Vining Memorial Church Cathedral, Ikeja, Lagos. She was happily married to Professor Alaba Akinshete, who retired as Professor of Mechanical Engineering, University of Lagos, and was a past district governor, Rotary International District 9100. They are blessed with many successful children and grandchildren. Distinguished ladies and gentlemen, I am honored and delighted to introduce this morning the very beautiful, elegant woman of substance, a teacher of teachers, a mentor of mentors, my mentor professionally and in the Akinshete family affairs, my iyale, my aunt, the distinguished professor of hematology and blood transfusion, our guest of honor for today, Professor Ibironke Akinshete. Professor, please, let's give her a rounding applause. Thank you very much. DC.
Thank you, Annette. Good afternoon, good morning, distinguished ladies and gentlemen. The last speaker from the federal government read the protocol, so allow me to stand on the protocol. I thank Sickle Cell Foundation of Nigeria for their invitation to be the special guest of honor at this year's foundation. And I thank them for the significant and I appreciate what they have done in putting sickle cell on the front burner. Their vision in 1994 is to alleviate the burden of sickle cell disorder in Nigeria and to ensure that I repeat, that all affected persons can live normal, pain-free lives. Their mission then also is to develop and sustain a world-class national sickle cell center and drive the research for effective solutions to the problems associated with sickle cell and related disorders in Nigeria and beyond. This foundation has made tremendous progress and innovations which have benefited several patients and their families. And we can now confidently say that sickle cell disorder is not a death sentence. I thank my colleague, my big brother by 2 years, and friend, Professor Olufemi Akinyoju, for making this vision and mission a realistic one. Professor Akinyoju and myself were involved in the diagnosis and care of adult patients attending the sickle cell clinic in Luth. I know that he faced many challenges in setting up this foundation, but through perseverance, hard work, and support from several organizations, the staff of the foundation, patients and families, the mission and vision of the foundation is being realized and sustained. Give them a round of applause. Several milestones in research and care have been achieved, which had led to many patients living longer, productive lives. It has reduced the incidence of strokes in children with sickle cell disease by sickle cell disorder, by stem cell transplantation from donated bone marrows in those who have sickle cell disorder unaffected but biologically compatible siblings. And we hope that with some more research, cure by gene therapy, which does not require transplantation, will be available. However, one area which has worried me and troubled me has not received adequate attention in Nigeria and many other African countries. This is the area of modern comprehensive care. I repeat, the area of modern comprehensive care. I know that this was the theme of the foundation in 2007, of the World Sickle Cell Day in 2017. But unfortunately, this has got very little attention. Nigeria has been reported to have the highest burden of sickle cell disorder worldwide. However, care is still suboptimal. It is fragmented and uncontrolled. There is urgent need for us to have a controlled, holistic, and comprehensive approach for the management of sickle cell disorder. This type of management has led to affected persons living longer, productive lives. It has reduced the incidence of stroke and many other complications. Sickle cell disorder patients are best managed by a multidisciplinary team of professionals who deliver comprehensive care. It is a team-based approach that covers various aspects of the patient: physical, mental, and social well-being. It is a model of healthcare based on interaction of medical and non-medical services with the patient and their families. It involves patient-parent information, genetic counseling, social services, prevention of infection, dietary advice and supplementation, psychotherapy, renal and other special medical care. Unfortunately, this is not the case in many hospitals and states in Nigeria. There is an urgent need for concerted efforts to tackle this problem, as we have increased survival in our patients with this condition. There is a need to have a national strategic plan which will be developed by all the stakeholders. The federal and state governments, medical services providers, patients, and their families to identify the strengths and weaknesses, the opportunities and threats of sickle cell disease. This also poses numerous economic, social, and financial costs for the government, the patients, and families. I believe this can be done. I listened carefully to what the representative of the Federal Ministry of Health talked about. They have plans. They have strategies coming in, but it is not a national strategies, and it is very isolated. We have things going on in several places, but I believe we need to put everything together in a master plan, strategic plan, which would involve the federal government, the state governments, the stakeholders, many of you here, the families and friends. And I believe this is the time we need to do this in Nigeria, because in August 2022 in Lomé, Togo, African health ministers launched a campaign to ramp up awareness, prevention, and care to address the burden of sickle cell disorder during a WHO regional conference. The health ministers pledged to increase political will, engagement, and financial resources for sickle cell disease in Africa. This was all talk, but nothing is happening. And therefore, it is up to us, stakeholders, to do something about it. And I believe because of this pledge taken in 2022, we also need to rise up to the occasion. I believe the National Strategic Plan, which I am suggesting, will be developed and costed by all stakeholders and presented to the federal and state governments, international donors who are present at this meeting in Lomé, WHO, USA Department of Human and Health Services, Novartis Foundation, Global Blood Therapeutics, and Sickle Cell in Africa for financing, because it is expensive. It is expensive for the government, it's expensive for the patients and their families. And therefore, they need to be supported by funding from these international agencies. Now, this has been done for other diseases. It was done for HIV/AIDS. There's a strategic plan which was done, and it is through this strategic plan that the care and support of those living with HIV is being supported nationwide. And I don't see why it cannot be done for people suffering from sickle cell disorders. It is now up to us, who are stakeholders, to make sure that this pledge taken by the health ministers will be supported by action. And that action starts now, I believe, because we must not allow it to just be talk without any action. It depends on you. And I believe that the Sickle Cell Foundation is in a position to spearhead this, because you have what it takes. You have the resources, you have the you have the resources, you have the backing of several people and the support. And I believe they can take this up as a challenge, because it is the only way to deliver well-structured, comprehensive health care to all those, I emphasize, to all those who suffer from this disorder. I know Sickle Cell Foundation can do it because they have what it takes. I wish them all the best And I'm looking forward to the information. I'm looking forward to them. In about a year's time, I would like a feedback on how how comprehensive care can be set up in Nigeria. And those who cannot afford bone marrow transplantation or stem cell foundation or all the other things can be in this thing so that it involves everybody. We have a huge burden. It's only a few people that can take advantage of some of these superior management. And I believe they can do it. I wish them all the best. I thank all the people who are here, the warriors. You'll be part of it because your voices have to be heard on how this can be done. And I believe that Sickle Cell Foundation is a challenge. And I believe you can take it up. Thank you very much.
A wonderful round of applause for Professor Ibironke Akinshete. I know we can do better than that. I know. Wonderful. That's the only way to describe it. I was saying in my mind, when I grow younger, I want to be like her. He walked in, we've been expecting him, and he walked in quietly. He's a permanent secretary, Lagos State Ministry of Health, Dr. Olusegun Ogboye. Please, let's acknowledge him. We've been waiting for you. The camera wants to see more of you, sir. Those who are online, wherever they are in the world, want to see you as well. Thank you very much, sir. All right, we're going into presentation of papers by distinguished academic and persons. I will be reading the profile of the first person who will be coming up to speak to us for about 20 minutes. They are professors, but they will make it understandable and comprehensible for each and every one of us. He's a graduate of the University of Ibadan, the premier university, where he obtained his MBBS degree in June 1984. He had his residency training at Lagos University Teaching Hospital and obtained his fellowship of the West African College of Physicians, Faculty of Pediatrics in 1996. He was employed as Lecturer 1 in the Department of Pediatrics, College of Medicine, University of Lagos in October 1999, and rose through the ranks to become a Professor of Pediatrics in October 2011. He is a Fellow of the Nigerian Academy of Medicine. In the past 2.5 decades, he has had extensive training and has been a trainer both locally and internationally in the field of pediatric hematology and oncology and in HIV medicine. He attended the workshop training on pediatric HIV management at the Golda Meir Moshe Carmel International Training Center, Haifa, Israel in 2007. He was also at the St. Jude Research Children's Hospital, Memphis, Tennessee in 2012 on observership in children cancer management. He is the chairman of the Bone Marrow Transplant Working Group, working with the Lagos University Teaching Hospital in conjunction with Sickle Cell Foundation Nigeria, championing the cause to bring to Nigerians a well-equipped bone marrow transplant center in Lagos. He has carried out extensive research in pediatric hematology and oncology with special interest in sickle cell disorder management and research. This includes research into local products and the management of the disorder. This led to his involvement in the investigations of a local medicinal product, Sickle, for the treatment of sickle cell disorder. He has also conducted research in the use of solamine and L-arginine in the management of sickle cell disorder. He has participated in extensive research and care of pediatric HIV disease in Nigeria and is an active participant in PERFA APIN program in Nigeria in collaboration with his co-workers. He has developed management protocols for pediatric cancer care in Nigeria. An honorary consultant to Lagos University Teaching Hospital, Diaraba, Lagos, he has authored and co-authored more than 78 articles published in both national and international peer-reviewed journals. He has successfully supervised and mentored more than 20 specialists in his area of specialization over these years. He is married and blessed with 4 lovely children and 2 grandchildren. Please make welcome Professor Edamisen Temiye.
my teachers, and it's good to be here today and see you once again. And I'm happy to be here, dear colleagues, our clients, our patients. On this day, we are celebrating the Sickle Cell, World Sickle Cell Day for year 2023. I will be observing the already established protocol. The topic I have been given is advances in management of sickle cell disorder. But when I saw the advances, and I get worried a bit, and the reason why I'm worried is what Professor Akinshete has said. The major problem, the major advances that are occurring in sickle cell disorder is the comprehensive care. That's what I have observed. I almost wanted to stop there, but I don't want the Professor Adeyemo to have anything to say. So I will therefore try to give some background on what I'm going to say. There are going to be a lot of medications that they mentioned, and we see why the comprehensive care is the basic, the bedrock of taking care of sickle cell disorder. The slide, please. Since sickle cell disorder was, who is changing this slide? Is it with me or them? Okay. Since 1910, when the disorder was described, we have since then have a lot of progress made. And the major reason why we have made progress, let's see the figure below that we're going to see next. And we see since 1910 what progress has been made year by year up to 2010. And from 2010, more advances have been done, mainly based on a pathophysiologic understanding of sickle cell disorder. Unfortunately, that particular year from 2030 date, most of the things that have been discovered have not added too much to the survival of sickle cell disorder children and adults. And that is what they asked me to talk about. Next. So the major contribution that has made a lot of people with sickle cell disorder to live has to be based on early diagnosis, prenatal and neonatal diagnosis. When you know that this pregnancy is going to result in the delivery of a sickle cell disorder child, or very early before the age of 6 months, you know what is happening. Then you start planning on what to do, and you start implementing what to do to make sure that that child survives. Penicillin prophylaxis has been very helpful. Immunization against encapsulated organisms, especially pneumococcal, and better medical care, education of the parents, and the health caregivers have contributed tremendously to what we have today, more than some advances we had since 2010. Next. 3 major things have happened and that made most sickle cell disorder patients to survive. They include blood transfusion services that is available, hydroxyurea therapy that has done a lot of tremendous help to those who have sickle cell disorder, and of course, bone marrow transplantation. Next. So you will see that in the US, between 1910 and 2000, you see that a lot of people who have sickle cell disorder live less than 10 years. By the time the National Sickle Cell Control Act enacted in US, we have a guideline for Nigeria now, and then penicillin, preventive penicillin therapy is there, hydroxyurea is introduced, transfusion to prevent stroke is introduced. You can see that by 2000, most sickle cell disorder patients were living up to the age of 45. Today, they live as much as 52, averagely. And if you know the life expectancy of Nigeria is, what is it now, 50 or something like that? 48. So in developed country, an average person with sickle cell disorder lives longer than an average person in Nigeria. And it's because of these simple things that have been introduced in those places. Next. Next slide, please. So one of the comprehensive maintenance care, I have a simpler one here, early diagnosis, what you do, how you check your blood, how you do red cell typing so that when the person needs blood transfusion, you know what to do, how you check the liver, you check the kidney, and what you do year by year for them, eye examination, dental care that you have to do from the beginning, which are not readily available in Nigeria. In fact, we just remember, hey, have you visited your dentist? Oh, when did you? It was not planned. And this should be planned when you visit your dentist, when you see the eye doctor, when we check your growth, find out whether you are growing well, you are eating well, check your chest. All these things are very important. Transcranial Doppler, which fortunately became available in Lagos through the Sickle Cell Foundation. In fact, let me just say a short story about the transcranial Doppler here. When it was introduced, before it was introduced, I had a very bad experience. One sickle cell disorder child presented to me with first stroke a day earlier. On the day of presentation, he had a second stroke. Within 48 hours, he had another 2 strokes and became wheelchair bound. And it shocked, it disturbed me. And we have been hearing about this transcript. Fortunately, around that time, this procedure became available here. The second thing is that what do we do? It's from then I started to say, okay, we must do a chain blood transfusion for them. Those who have these, who have abnormal transcranial Doppler. And we started saying, it's quite stressful. Last week was a blood transfusion day. Please, how many of us donated blood there? Who is not sickle cell disorder? Who donated blood here last week? And so you see when we ask them to come and they need blood transfusion, and it is a struggle to get blood for them. So those of us who are here, regular blood donation will help us in taking care of sickle cell disorder children and adults and adolescents. Next. So this is a more comprehensive thing of what you do from neonatal period, how you make your diagnosis, or prenatal period, and what you do for the first 6 months, what you give. For example, the penicillin, oral penicillin, is said to be given up to 5 years. People like me leave them on it for as long as it is possible. It does no harm. Of course, taking Progranil, we hope it's still active, daily is very important. Doing hearing tests, doing kidney tests, and making sure these children and adults and adolescents are not exposed to a stream of weather conditions are very important. And it's why you know very early that you can implement this. Next, I have only 20, I have just spent 20 minutes. Next, just let us go through this up to the adolescence period. Move on. I don't have much time. So I did this up to adolescent age when we take care of this sickle cell disorder patient. Next. Now, what are the new things that are happening? Sickle cell disorder is a multifaceted disorder. I put this slide there, if you can see it. The first thing that happens is sickling. And what causes the sickling is polymerization of the sticking together of the hemoglobin, which we call polymerization. It makes the cell to sickle. Once that happens, every other thing that happens down the line, up to the point of causing vascular damage, of causing kidney damage, of causing stroke, happens. And the one event leads to the other. You see that I have 4 cycles there. All those 4 cycles, they intersect. They overlay each other. So polymerization leads to sickling to hemolysis, that is breaking down the red blood cell. Breaking down the red blood cell leads to release of hemoglobins. Hemoglobins, then they are broken down to